Some of the first things I saw at Coast General Hospital was actually a monkey walking up the stairs when I was on my way to the dental unit. I was also taken back by how large the hospital was and how free roaming it was, with patients and visitors being able to just kind of go wherever they felt like. I was placed in the dental department, and there was about like 9 different sections in the dental department that I could go visit. So it was always cool just knowing in the next room there's a different procedure going on that I could go observe and shadow. The dentistry department was very welcoming. I grew tight relationships with all of the dentists there, and really just grew a liking to all of them. There isn't anything bad I could even think to say about the department. Like it truly was a good time. Lots of learning from some of like the head doctors there. It compares in a way where it is different resources, and the resources are a little more lower, whereas like in the States it's a lot more technologically advanced and a bit more hygienic, but overall they're still just so creative with their methods. Like, for example, one time the light stopped working in the middle of a procedure, so someone just used their phone flashlight, and because you have to come up with something right then and there, and that's just an example off the top of my head. The patients all had like a booklet they gave that kind of had all their information, whereas it's usually digital and you can just pull up their profile and get all the information. It all was, everything was handwritten. All the database and clientele storage was done in a large notebook. My dental training back home prepared me in the sense where I knew I was gonna have to stand a lot and just have long mental span, attention span, where I would just be standing there and just focusing on like what's going on and all the moving components. So that mental presence aspect, like that I was able to train beforehand, really came in handy. A memorable case I had uh, observed was a man had about a tumor the size of about a softball on his gum, and it was coming out of his mouth, and he didn't remove it for 10 years because his friends were telling him that it was witchcraft. However, he also was using it in order to receive government aid. So for a long time, he didn't want to get it removed because it was helping him get by. And another case would have to be the time I was observing a dental surgeon who was extracting a wisdom tooth, and blood spurted all over her mask and face because she wasn't wearing a splash guard. Over the past 2 weeks, definitely just mental perseverance and making sure that you assert yourself respectfully into the setting, so that way you can get to see what's going on, get to get to educate yourself and ask questions, and just really kind of developing that I want to be here sort of energy. My biggest achievement during the placement was probably when they gave me, I was able to get some wisdom teeth that I'll be able to work on in dental school. I thought that was very nice of them. Yeah,
A full tooth?
yeah, like a healthy tooth that I'll be able to practice. Because in dental school, you need teeth that you can practice on, and usually they'll charge you, but they had some ones for free that they were going to throw away, and they put them in a jar for me. It taught me that not every case you have is going to be textbook, and sometimes you have to come up with on-the-fly solutions and just think outside the box for things. And everything that you see happen usually is preventable early on. So just kind of having like some sort of visual to show people of like what could happen, or like just really nipping things, early warning signs early, so they don't hinder like the person's health and like build up to a big cost.